Hello dear audience, welcome to another episode of Health Par Charcha. Today we have with us Dr. Rohit Singh, consultant liver transplant surgeon. We will know more from him about hepatitis on this occasion of World Hepatitis Day that is observed on 28th of July. We are spreading awareness about the inflammation and the kind of problems caused in the liver. Thank you so much, Doctor, and welcome to our show.
Thank you.
Doctor, we would like to know what are the different types of problems that can occur in the liver.
Okay, so it's World Hepatitis Day. Let me introduce the audience about what hepatitis is. So hepatitis can be broken down into hepa and itis. So hepa means liver, itis means inflammation. So anything which causes an inflammation of the liver is hepatitis. So in India, nowadays we are facing a lot of issues with the term known as non-alcoholic fatty liver disease or steatohepatitis. This means the diet and lifestyle which we are following now is causing fat accumulation in the liver, which in turn is causing inflammation of the liver. So this is one of the causes. Another important cause of liver disease is the use of alcohol, which I think it's very common in India and abroad also. The third, which is most common cause of hepatitis, is the viral hepatitis. Viral means we have 5 types of, if you go through it, it's 5 types of viral hepatitis. A, hepatitis A, B, C, D and E.
So, what are the precautionary measures to be taken against these?
So let's divide it into all the 3. Let's first talk about the non-alcoholic fatty liver disease or non-alcoholic steatohepatitis, which is accumulation of fat in the liver. So the most important precaution to prevent NASH is healthy and an active lifestyle. So people should be out and about like more than half hours of the day, more than 12 hours of the day. They should be active, and they should not be taking high calorie diet. And if a person who has obesity or it's more than BMI of more than 30, then they should go on diet and lifestyle change. So this is the prevention for the steatohepatitis. Alcoholic hepatitis is you have to abstain.
You have to take care of yourself. You have to be mindful.
Yes. It's this is not a precaution. This is like an advisory to all. Don't take alcohol in that much manner, so as to prevent alcoholic hepatitis. Coming on to the viral hepatitis, which is also a very major concern, because hepatitis A and E is spread through taking in contaminated foods. Now in our country we see the most commonly foods that we encounter which causes hepatitis A and E are ganne ka juice and the pani puri and golgappe, which is unhygienically prepared water, that water which has not been sterilized, which has not been heated, and so that gives a medium for hepatitis A virus to grow, and when we consume that virus, so this is usually spread by taking in that contaminated food. So that virus then, after reaching your gut, goes into the liver and causes inflammation of the liver. Hepatitis A is most commonly seen in children. So the children who suffer from these problems develop jaundice after eating some bad food, usually have hepatitis A and B.
What are some of the tests that you recommend for a person who might be at a risk of developing liver disease or hepatitis?
So if someone comes to me and he says, I think I have some liver issues, my first test would be a liver function test. It's a simple basic test to determine how well your liver is functioning.
That is the LFT.
LFTs, yeah, simple LFTs. The LFTs will give you a fair idea how much damage your liver is And if the person has an history of B or C in their family, some basic blood test to detect hepatitis B or C in their blood. It's the markers are HBs antigen and DNA levels, also the viral DNA level. How much is the load of virus in your body? So the basic tests are usually the blood tests. So by doing simple 1 or 2 tests, we can detect the liver status and the status of the various viral, alcoholic or the steatohepatitis.
So they can take a general routine full body checkup?
Yeah, definitely. A full body checkup will help you in detecting almost your entire the functioning of your body, the functioning of your liver, kidneys, and a basic ultrasound can detect whether it's a fatty liver or not. And yes, a simple routine test, if you think you have a problem, should be done at least twice a year.